Welcome to How to Treat Your Child for the Common Cold, a comprehensive look at what mothers can do when their child comes down with a head cold.
Mommy, I'm sick.
Mommy, I'm sick. Has your child ever said this to you? As a mother, the moment you hear these words, you immediately switch from chill mom mode to nurse mom mode. Your little one is sick, and assuming he's not faking it, you need to quickly determine just how sick they are and how to bring them quick relief. But how much do you really understand about the common cold and how to treat it? Do you know what to do when symptoms set in? What about for the duration of the cold? Do you know how to reduce the severity of your child's symptoms? Do you know how to prevent future illness in yourself and others? All of that and more is what we'll explore in this video lesson. If you want quick answers to your questions, here they are. First, as soon as your child says he feels sick, check his temperature. If it's 100.4 degrees Fahrenheit or higher, keep him home until the fever is gone for 24 hours. To bring a fever down at home without medication, offer him a lukewarm bath or place a lukewarm washcloth on his forehead. If the child's symptoms started in the past day or two, this is the best time to visit the doctor for tests. It might not always be necessary to go to the doctor for the typical common cold. If you do go, the doctor might run tests for other viruses like influenza, COVID-19, and strep. The test results will help you know what you're dealing with, what to expect, and how to treat it. Generally speaking, the best over-the-counter or OTC treatments are a decongestant with phenylephrine or pseudoephedrine, a pain reliever with acetaminophen, and/or a nasal spray with saline or oxymetazoline. However, OTC treatments are not always needed and are sometimes not recommended. OTC treatments depend on the child's age. For instance, most cold medications are generally not recommended for children under age 2. Follow the directions on the medication's box or bottle to know what dosage is appropriate for the age and weight of your child. You might also talk to your doctor or pharmacist. The best at-home treatments are plenty of sleep and rest, warm liquids like chicken broth, ginger tea, and a saltwater gargle, steam or humidified air, hydration with water and electrolytes, and time. In this course, we'll start by defining what we mean by the common cold. We'll introduce you to the many signs and symptoms of a cold and explain how a typical head cold runs its course. We'll then discuss the sudden role shift that you'll take on as a mother turned nurse, as well as what your child can do to find relief and speed up his or her recovery on sick days. Finally, we'll look at home and over-the-counter remedies, when to contact a healthcare professional, school policies, and how to prevent future illness. For the purposes of this presentation, we are going to assume that the person who is sick is generally healthy otherwise, has no underlying health issues or concerns, and has a well-functioning immune system. With that, let's dive in. What is the common cold exactly? It is a virus that can primarily affect a person's nose, throat, sinuses, and windpipe. It can also affect the ears, eyes, and lungs. You may hear it called an upper respiratory infection or a head cold. It causes a mild irritation that is limited to those areas of the body. Symptoms can include a runny or stuffy nose, sore throat, sneezing, coughing, headache, congestion, fatigue, or fever. Symptoms are typically mild. The virus usually resolves itself within 7 to 10 days, although some symptoms, like coughing and sniffles, may last longer, possibly 2 to 6 weeks after the virus has run its course. Did you know that the common cold is not limited to one virus? Over 200 viruses are known to cause the common cold. The rhinoviruses are notorious culprits. Their name even means nose venom in Latin. Viruses can be compared to a computer virus. A cold virus enters your body and infects it with genetic material. Much like a computer virus enters a computer and unleashes malicious code to bring down your system. Fortunately, your body's immune system detects and deprograms cold viruses, like how antivirus software fixes a computer. Your body even remembers the virus's code so that it can ward off that virus better next time if you get infected with it again. It's pretty amazing. Viruses are not the same as bacteria. Bacteria are one-cell organisms. Most are beneficial to humans. Viruses, however, are generally harmful to humans. Bacteria can split themselves to reproduce. A virus needs a host like the human body so that it can make copies of itself. Another key difference is that viral cold infections cannot be treated with antibiotics. Antibiotics only treat bacterial infections. So don't be surprised when a doctor does not prescribe antibiotics for your child's viral cold. Common cold viruses are not the same viruses that cause the flu, COVID-19, or a host of other viruses. The flu and COVID-19 have different and more severe symptoms than the common cold. They can even lead to serious complications or fatal outcomes, while the common cold does not. While we have vaccines for viruses like influenza and COVID-19 strains, there is no vaccine for the common cold. There is also no medical cure for the common cold. It's not that scientists don't know how to make vaccines. The problem is, it would be nearly impossible to pair up an effective vaccine against over 200 viruses. Can you imagine getting over 200 vaccination shots just to ward off all possible common cold viruses? Plus, viruses mutate often. It would be very difficult to keep up with all those viruses. Vaccinating people against the common cold just isn't practical. Because common cold viruses produce short-term, mild symptoms, the typical standard of care for them is to treat the patient for symptom relief. Let the virus run its course, and let the body's immune system do its thing. The first sign of the common cold is typically a sore or tickly throat. Symptoms that follow within a day or two include a runny or stuffy nose, fatigue, and a low-grade fever of 100.4 to 102.2 degrees Fahrenheit. The person may also experience a headache, mild body aches, or stuffy ears. Later symptoms typically include lingering fatigue, coughing, sneezing, and yellow or green mucus. Let's look at these symptoms a little more in depth. Usually, the first sign that a cold is coming on is a sore, scratchy, or tickly throat. You may cough a little or clear your throat a little more than usual as your throat becomes irritated. Over the next couple of days, you'll experience more symptoms, including sneezing, a runny nose, head congestion, fatigue, and a low-grade fever. A low-grade fever is between 100.4 and 102.2 degrees. Fatigue takes the form of a general feeling of being unwell, sluggish, or off. You may also have some brain fog as your body begins to divert its resources to fight off the virus. The next couple of days bring the most severe symptoms of the common cold, including coughing, sneezing, headache, body aches, fever, and fatigue. The symptoms are mild, especially compared to the flu or COVID-19, and any fever is low grade. Symptoms start to ease between days 4 and 10 to 14, but you might still experience a runny or stuffy nose, yellow or green mucus, throat irritation from postnasal drip, that's when your mucus drains down into your throat, coughing, and stuffy or plugged up ears. This stage is when your runny nose may shift from clear and watery mucus to thick and colored mucus. Green or yellow mucus is normal and is not a sign of a bacterial infection. The color comes from the cells in your body that are capturing all the germs and flushing them out of your system every time you blow your nose or swallow it down. Green or yellow mucus is a good sign and indicates normal progress for the common cold. Once the virus has run its course, you may still have residual symptoms that can linger for up to 6 weeks. Generally, most people feel better by 2 weeks after the onset of symptoms, but full recovery can take days or weeks longer. Lingering symptoms can be annoying, but they're nothing to worry about and they're treatable with continued rest, targeted symptom relief, and patience. Sometimes a virus weakens your defenses against bad bacteria. This can lead to a bacterial infection. If you develop a bacterial infection, you'll need different treatments than you would for a viral infection. Signs of a bacterial infection include symptoms that don't improve after 2 weeks of illness. A fever over 100.4 degrees Fahrenheit that doesn't improve. A fever that stays over 102.2 degrees. A new fever in what should be the late stages of the cold when you wouldn't typically have a fever. A fever that returns, thick, pus-filled, or bloody mucus. A persistent wet cough. Pain in your sinuses, cheeks, forehead, eyes, teeth, jaw, or ears, especially if it's worse when you lean over or bend forward. And red, swollen, or tender skin. These can be an indication that your viral infection has developed into a bacterial infection, such as in your sinuses, middle ear, lungs, or skin. Typically, you don't need to see a doctor for the common cold because symptoms are mild, treatable at home, and run their course in a predictable way. But there are some times when you may want to or should contact your healthcare professional. During the first couple of days of symptoms, you may want to go to the doctor for 3 main reasons. 1. To get tested to rule out influenza, COVID-19, and other causes of illness. 2. To get a doctor's note for school or work. Or 3. To get symptom relief from a doctor's prescription. After day 3, it's especially important to monitor your child's symptoms to make sure that they don't worsen or develop into a bacterial infection. Visit your doctor if you notice any of the signs and symptoms of a bacterial infection. Because bacterial infections are treated differently than viral infections, your child may need a doctor-prescribed antibiotic or other treatments to clear it up. Finally, you might want to see a doctor anytime that 1. Your child's symptoms don't clear up the way a typical cold virus should. 2. Your child's symptoms worsen. Or 3. Your child's illness doesn't follow the typical pattern of the common cold. As a mother, once you hear the words, "Mommy, I'm sick," you instinctively become a nurse to your sick child. The first thing you should do is check your child's temperature. If it's 100.4 or above, keep him home. That means no school, no sports, no church, no scouts, no birthday parties, etc. The reasons are that his body needs its full resources to fight off the infection, and he may spread a highly contagious cold virus to others. Sometimes your child complains of a sore throat but has no temperature, so you send him to school. Be aware that you might get a call from the school in a few hours that your child now has a fever and they want you to come pick him up. A lot of parents say, "But he didn't have a fever this morning." That's because he was in the earliest stages of the cold and the fever hadn't developed yet. Now that the fever is here, the school is sending him home. To avoid getting this phone call, disrupting your day, and making an extra trip to the school, you might decide to keep the child home with only a sore throat. This is because in the typical course of a common cold, a fever will follow within 24 hours. Many schools have policies for illnesses. Be familiar with them so that you can follow protocol, such as how to turn in an absence note and grading policies for late or missed work. If your child is sick on a school day, inform the school that he will be absent due to illness according to the school's instructions. You might also request that a sibling or neighbor bring home makeup work, or the school may have online options or requirements for missed lessons and assignments. Similarly, if the child has any other commitments like sports or an after-school activity, send the coach or leader your regrets. Sometimes parents think a sick child should toughen up and go simply because they made a commitment. But the truth is that a sick child will be too drained of physical and mental energy to perform at their best level. Plus, the virus is likely to spread to others. Ask yourself this: would you rather keep your sick child home for a couple days, or bring the whole team down with illness? Also, not letting your child rest could lengthen his recovery time. Decide if your child should go to the doctor. If you go, visit within the first 1 to 3 days of the illness when the virus is active so that the doctor can get accurate test results. On the other hand, if you're sure it's the common cold virus, you don't need a doctor's note, and symptoms are typical, then your child can simply stay home and you can let the virus run its course. Now it's time to play nurse. Your role is to set your child up for comfort and recovery. Make sure he gets lots of sleep because when it comes to the common cold, rest is best. Don't be in a rush to send your child back to school. It typically takes 5 days after the first sign of illness before his energy comes back. Finally, keep yourself from getting sick. Try not to let the patient cough or sneeze on you. Use gloves to pick up dirty tissues. Wash your hands often in hot water for 30 seconds. Wash clothes, blankets, and book bags in hot water. Sanitize surfaces. Make sure you get the rest you need to. This won't guarantee that you won't get sick, but it may help. The role of a sick child is primarily to sleep and gradually get better. Rest and time are the best ways to treat the common cold. Other treatments are to make the sick person comfortable by relieving pain, reducing fever, and ensuring that symptoms don't worsen or that a bacterial infection doesn't develop. Again, don't rush the child back to school or activities. The peak time of illness for the common cold is typically the first 5 days of symptoms. I remember when my high school teacher said to me,
"You don't get sick often, but when you do, it's for a whole week."
It was true. I only had 1 cold per school year, but it knocked me out for 5 days. Why? Because that's the typical course of the common cold. So settle in and give your child time to get well. It's okay to let your child watch TV or play video games until he is doing those things instead of resting. If you sense he is playing instead of resting, then turn off the devices and order him to sleep. Chances are he'll nap. Also, make sure he isn't using electronic devices to communicate with friends at school. This distracts his friends and potentially gets them in trouble during class. Your child's role is also to tell you if his symptoms worsen change, or are new developments. That will keep you as the caregiver informed of the possibilities of a bacterial or other infection that may require going to the doctor. Finally, your child is responsible for doing makeup work that was assigned while he is absent. Let him contact classmates and teachers after school hours if he has any questions. But also, don't force your child to do mental work while he is fatigued or has brain fog. Work with your teacher or school as needed to keep up with assignments. Here are some commonly used, doctor-recommended home remedies for the common cold. Number 1 is get plenty of rest. It's normal for your child to nap more and sleep longer than usual while fighting off a cold. When your child is awake, it's okay for him to do quiet activities in a resting position, like reading books in bed, playing with dolls on the couch, or using electronic devices in a chair. Just don't let these activities rob your child of much-needed sleep. Your child may find extra relief in sleeping with their head elevated, such as with an extra pillow. This position relieves pain and pressure on the sinuses and reduces postnasal drip, which irritates the throat and causes coughing. Steam up the bathroom with a hot shower for 10 to 15 minutes of relief. Have your child breathe in steam from boiled water or a humidifier. As the caretaker, make sure you clean the humidifier often to prevent mold buildup. Massage your child's sinuses to relieve pressure from mucus. The sinuses are located in the middle of the forehead and tops of the cheeks. Start at the outer cheek, then apply gentle pressure and slide your finger across the cheek under the eye and toward the nose. This moves the mucus out through the nostrils, giving much-needed relief. You can also do this from the middle of the forehead down to the nose, as well as from the bridge of the nose down toward the nostrils. If your child is younger, teach him how to blow his nose gently into a tissue, then dispose of the tissue in a trash bin, and wash his hands in hot soapy water for 30 seconds afterward. One way to get kids to wash for 30 seconds is to sing the ABC song or Twinkle Twinkle Little Star. Make sure your child avoids blowing harshly because it can further irritate his sinuses. Blowing the nose frequently or licking dripping mucus off the upper lip during a cold is common. To heal sore skin on the nose or lips, use petroleum jelly, lotion without fragrance which can sting, aloe gel, or lip balm. For kids who are able to do so without swallowing or choking, gargling warm salted water can soothe a sore throat. Drinking ginger tea can also achieve this and is tastier. Honey can coat the throat and calm a cough. It also has antibacterial properties. You might add honey to the ginger tea, for example. Note that honey is not recommended for kids under age 1 due to the risk of botulism. Baby that fever with lukewarm baths or washcloths, light and loose-fitting clothing, and a cool room temperature. This prevents overheating and provides comfort. Sick days can be a great time to bond with your child. You can read books to him while snuggling together under a blanket. You can role-play as a patient doll who gets treated by a doctor doll and is soon all better. You can tuck your child into bed like a baby burrito and offer to bring him food and drinks or turn on his favorite movie or TV show for him. Rock him to sleep while singing a lullaby. Who knows? Maybe your sweet child will even look up with a smile at you and say,
"Mommy, I love you."
Finally, remember that the typical common cold virus follows a predictable course, so give it time and allow several days for your child's symptoms to improve. Some people swear by home remedies or traditions passed down the generations. Do you know of any good ones? If so, please share them in the comments. Now let's look at some over-the-counter remedies. It's generally okay to use saline nasal spray or drops. They're quite safe, even for infants. They help loosen mucus in the nose. You could also use a bulb syringe or nasal aspirator, especially for infants, toddlers, and other children who can't blow their nose. They help remove mucus from the nose. Neti pots are not recommended. Fever reducers like acetaminophen or ibuprofen, when age-appropriate and dosed correctly, can help bring down a temperature and give pain relief within about 20 minutes after taking it. Note that ibuprofen is not recommended for younger children due to the risk of Ray's syndrome. Cough and cold medicines are not recommended for children under age 6. For kids over age 6, you'll usually only use them with a doctor's approval. Hand sanitizer can help prevent the spread of the virus, but it is not a substitute for proper hand washing. If you dispense medication to your child, whether it's over-the-counter or prescribed, it's important that you follow the instructions. If you have questions, contact your doctor or pharmacist. Lastly, if your child is having a medical emergency, call 911 right away. School policies on attendance, illness, and makeup work differ depending on your school district. You'll need to be familiar with your school's policies, which you might find online or in a student handbook. Some common policies to think about are excused versus unexcused absences, whether a doctor's note is required, how many total sick days are allowed per school year, if there are restrictions on the number of consecutive sick days or sick days per school year, how regular classwork and homework assignments can be made up. What are the consequences if they aren't made up? What is the policy on taking quizzes and tests missed due to illness? What are the requirements for returning to school, such as being fever-free for 24 hours without medication? And what are the policies on chronic absenteeism? It's important to know your school's policies so that your child's educational success can continue, even when they need to stay home from school with the common cold. Here are some ways to prevent the common cold. Practice good hygiene. Wash your hands regularly and properly, especially before eating or after being in public places or a place with a sick person. Use hand sanitizer when soap and water aren't available until you can wash your hands. Practice healthy habits. Eat a nutritious and balanced diet that supports your immune system. Try citrus fruits for vitamin C, peppers for vitamin A, protein for zinc, and garlic for antimicrobial properties. Stay hydrated by drinking plenty of water through the day and incorporating electrolytes such as calcium, potassium, salt, and magnesium. Get regular exercise and prioritize your sleep to boost your immune system. Get regular health checkups to catch health issues early. Stay up to date with vaccinations to protect against preventable diseases like influenza and COVID-19. Manage your stress. Chronic stress can weaken your immunity. Try stress-relieving activities like yoga, meditation, or pleasant hobbies. Finally, avoid harmful habits that can weaken your immune system like smoking and drinking too much alcohol. Practicing healthful habits throughout the year should help prevent the severity and duration of the common cold. We hope you enjoyed this lesson. Visit our website www.bookswv.com to download the companion materials to this presentation. Stay in touch with us so you don't miss out on more videos on these and other topics. There are many ways you can support and connect with Berkeley Books. Sign up for our free e-newsletter at bookswv.substack.com. Each month, you'll get our latest releases, event news, promotions, and inspiration for writers, readers, students, and educators. Follow us on social media. We're on X, Substack Notes, and YouTube. Purchase our products on Amazon and Kindle, Lulu, and Etsy. And visit us in person at special events where you can meet our authors and get your books signed. Remember to subscribe, like, comment, and share this video. And finally,
thank you for watching and stay